And welcome back to When IT Hits the Fan, brought to you by Rhyno Healthcare Solutions. I'm Christy Patillo, and this is Christy Pehanich, right? Am I anywhere close?
Yeah, Christy Pehanich, very
And
close.
what's nice is I know I can say your first name because your first name is my name too. And so that works out in the end. In fact, yours is how mine is always spelled on the side of Starbucks coffee cups. Um, but yes, could you please tell us who you are, what you do, and just give us a very overview of your general responsibilities?
Sure. So I direct a revenue cycle management team for about 3,400 billable providers across a multi specialty physician group. So my primary responsibilities are for that physician billing and accounts receivable management. But over the years, I've expanded into patient services pretty deep. So I'm responsible for point of service collections across our 6 hospitals and large physician group. And I also manage our patient service call center, which includes about 90 agents taking inbound patient calls and also doing outbound cash collection calls for patient obligation.
Excellent. And so, how'd you get here? What was your career journey that led you to specialize in revenue management for the healthcare sector?
Yeah, it's interesting because I thought in high school that I would go down the nursing path, and I've always been really, I guess, brought towards healthcare and caregiving. And as a high school student, and even in my early college years, I worked in a nursing home providing hands on patient care. So I was drawn to nursing from an early age. But when I went to start looking at nursing schools in the early 90s, it was super competitive, especially the local programs near where I lived. So I actually ended up kind of diverting from the patient care or clinical space to healthcare administration. So finished a associate's degree in healthcare administration from our local, you know, 2-year college here in Pennsylvania, and then ended up working at a healthcare organization doing charge entry and just learning the ropes, learning hospital billing. And slowly, then I ended up getting my bachelor's degree in health services administration. And then my employer helped me get my master's degree in health services administration. So step by step, I was able to build on my academics and, move from associates to master's degree over the course of 5 or 6 years. And at the same time, I was, developing my career, and getting into physician billing, physician insurance collections, managing a portfolio of accounts receivable, and really just learning the ropes. And eventually, that led me to a director position in Rev Cycle. And, from there, my career really just fell into place, having great mentors and, being able to undergo a lot of different development activities and employer driven leadership development classes. So that's, brought me to today. My present job is as an associate vice president of revenue cycle operations for about a $4 billion a year healthcare system in Pennsylvania.
Absolutely, and that amount is nothing to sneeze at. And revenue management, it's just so critical. It's such a critical function in healthcare, especially for payers, but also providers because they need to get the money in the end. What are the most significant challenges that you face in this area today?
Oh, I think that the fact that healthcare cost hasn't really been able to get reined in, despite government interventions, despite some of the things that have been done with administrative simplification and Obamacare and, just the various iterations of the marketplace. People are still struggling with access to healthcare and with the cost of healthcare. And over my career, I've seen just our self pay obligations and the amounts of money due from patients go from, what used to be a very small amount of our total patient cash to one of our top three payers, and hundreds of millions of dollars due from patients as employers try to keep their premium amounts low, then they have to push off more of the cost to their employees. So patients are just faced with these sometimes insurmountable bills. They don't understand them. There's a healthcare literacy issue still in the United States. So I think it's access and economics. How do people afford the healthcare that they really desperately need, either to stay well or to get treatment for an illness?
And let's press into the economics factor of this, just because the show is about taking all aspects of healthcare IT, from call center to data management, everybody, and just trying to illuminate all the different sectors to each other. Could you help explain why healthcare cost has just boomed over the last, let's say, since 2020?
I think that the provider organizations really haven't been able to um, create a charge structure that's really representative of the cost of care. So in the 90s, a lot of insurance payers reimbursed hospitals and physicians using a percent of charge
Yeah.
methodology. So if we billed $100 and they paid us 20% of charge, we were getting $20. And that's how the reimbursement system worked for decades. And over time, we've gotten away from percent of charge contracts and moved to fee schedule contracts, value based care contracts. And I don't think the the different parties in the healthcare equation, providers, insurers, employers that are providing so much of the insurance coverage for Americans, we're really haven't aligned yet on the charging mechanisms, and there isn't a standard reimbursement mechanism. So you're trying to deal with a variety of different reimbursement mechanisms, trying to have a cost of care that is reflective in your charge amounts. So it's just all been so complicated. And when you try to move from one payment methodology to another, like, it really takes time for all the different pieces to align. And I just feel like we're getting there, but it's going to be another 5, maybe 10 years until you really start to see healthcare organizations charging an amount that the layperson would say, well, that makes sense, and not $1,000 for a Tylenol pill, but $10 for a Tylenol pill. So it's just taking us a while to all align.
Yeah, rarely do I share stories from my own life, because the experts that come on are who should be sharing at all times on the podcast. But I am someone who has gotten a $1,000 glass of water at a hospital.
Wow.
And so, yeah, this is near to dear to my heart, not just because I work in healthcare IT, but because I'm a human with needs. But yes, how do you see the role of technology evolving in revenue management, particularly with the increasing adoption of automation and AI?
Yeah, I think there's huge potential for automation and AI and revenue cycle. Most, the common American, I don't think really understands what revenue cycle is, but we are behind the scenes, submitting bills to the insurance company, working denials. About 10% of all claims submitted to a health insurance company are denied and need to be reworked. So there's still a lot of documentation and information exchange that needs to happen between the provider and the payer in order to facilitate payment, and then to determine what the patient's obligation is. So that has led to a high cost to collect. So, a lot of healthcare organizations are giving their revenue cycle, 5 or 10 cents of every dollar they collect. So that's what we call our cost to collect. A good cost to collect is more, I would say, in the range of 3%, 3.5%. So in order to go from, a 5 to 10% cost to 3.5 cents on the dollar versus the latter, you really need to not need to throw people at problems. People are one of the highest expenses for any employer. So salary and benefits make up a huge amount of the revenue cycle spend. So as we grow and as payer policies become more complex, and we really want people to work at the top of their job description. So the mundane kind of pulling records to send to insurance companies to facilitate payments, fixing, demographic errors, or errors with registration or insurance information. A lot of that can be done with smart automated intelligence, and there's no shortness of data in healthcare. I mean, we have so much data, but we really need healthcare IT experts to help us, one, ensure the accuracy of that data, because AI is very data dependent. So we need to continually work to improve the accuracy of the data that we're using, but also really understanding the workflows within revenue cycle, and how can we at the very least start with automating simple tasks. So I think there are so many brilliant IT professionals that don't necessarily have revenue cycle domain expertise. And you really need to bring those two together. You need to have, that capable, innovative IT professional with a creative mind. But they also need to understand, the area in which they're trying to automate or bring enhancements to. So I think learning revenue cycle and learning that specialty, then once you couple those two skills, that's where you start to unleash the potential.
Mhm. And just at the high level,
Mhm.
what could give us a little cheat sheet? What would be the best first things for IT professionals to pick up about revenue cycle?
Sure. I think just understanding the stream of information flow. So, what components of a claim are sent to the insurance company? What types of automation are available to check benefits, to check eligibility, to check on claim status? So, there was a time where revenue cycle representatives were spending an hour on the phone asking an insurance company, did you receive my claim? What is the status of my claim? Has it been paid? Is it pending? Do you need more information? So sitting on the phone, going through a listing of claims one by one. And a lot of these insurance companies would say, well, after your 10th claim, you have to hang up and get back in the queue. So we're only going to status 10 claims at a time. So that is just such wasted time and effort. So now with automation, we can create bots and we can create processes that go into the payer portal and check, do they have the claim on status? Yes or no? Is it denied? If it's denied, why? What additional information is needed? Can the system procure that information and transmit it to the payer without human intervention? So I think that there's a lot of automation, that is available: claim review, claim statusing, posting cash, intelligent charge capture, making sure that all the resources and items that were used during an episode of care, the clinician's time, everything's well documented, and we're getting paid at the highest level of reimbursement due the organization. So I think it really starts with sitting down with a biller or a charge capture specialist or a coder, and really understanding end to end what is that person's workflow, and then being able to gauge where can we start introducing automation to reduce the time it takes to perform a task. And then when you do that and extrapolate it across millions of claims, now you're saving hundreds of hours, a week, a month.
Absolutely. And also just taking it in a little bit of a different direction. Healthcare regulations are constantly changing. How do you ensure that your team stays compliant while also remaining even slightly agile and innovative?
Right. So I've seen just recently companies or vendors getting into the space of where they've created automated intelligence, and they're
That's what
going
I'm
out.
hinting at, is that AI is a bit of a compliance nightmare, but it is
Yeah,
also brilliant for cost savings. So
exactly. And I've seen vendors that are now they check the CMS portals. They check, what Medicare policies have changed, what state guidelines have changed, and they're going out to the national payer sites and looking at payer policy, claims, and reimbursement policies, and then feeding that information back to revenue cycle professionals in a high level summary. So here's the regulation, here's what kind of healthcare organizations it applies to, and here's a checklist for you to implement controls to ensure that you're compliant with those regulations, but also then maintain a go forward practice, to ensure that you're keeping up to date. So I think that's a really cool area where AI can help us. So, like I said, I feel like the opportunities are endless, but it's still quite new in revenue cycle. And I
yes.
think that some leaders are still a little bit apprehensive about trusting automation, and they want to walk before they run. So I really feel like we're just in the beginning stages of really seeing what automation can do for a revenue cycle organization.
Absolutely. And collaboration between IT, hands on keyboard, and the business operational side of things is utterly crucial and doesn't always work well. A little bit of Capulets and Montagues going on. At least that's the pulse that I've taken from other organizations. Um, how do you think that collaboration best works between the IT hands on keyboard and operational sides of the business practice? Because in order to be developing these AI solutions, we're going to need some real software devs. And so, how do you foresee that going?
Well, I think there needs to be dedicated resources assigned to revenue cycle. Because at a lot of healthcare organizations, there's staffing challenges. So you're only going to have a finite number of resources. And if you don't have specialization and assignment, where these 5 resources are assigned to revenue cycle, these 5 resources are assigned to the clinical enterprise, another group is assigned to quality. What happens is there's a list of 200 things that all these different parties or work units want accomplished, and the clinical team is always going to win that tug of war. So revenue cycle kind of gets needs to get in the back of the line when it comes to our wants and needs, unless we have dedicated resources that are specifically there to support your given work unit. So what I've seen work is to have a dedicated group of health information technology professionals that are dedicated to the revenue cycle, that collaborate with operations. We can sit down shoulder to shoulder, and we can show them what we do, how we do it, what our obstacles are, what is taking a lot of time out of our day. And then they really need to just get familiar with the work. It's difficult to come in as an IT professional and try to enhance workflow or automate tasks when you don't understand what's being done and why it's being done. So it's just the journey of collaboration, and then the revenue cycle representative can learn from the IT professional what's possible. So I might not know what is able to be automated. I might think something is too complex to be automated. But if I sit down and show my IT partner, what I do, they can start to introduce ideas. And that's where the magic happens.
Yeah, I completely agree. I completely agree on all that. And so this is normally when I ask, what do you see coming in the next 5 to 10 years?
Mhm.
We've been talking about AI and automation this whole time. So instead, I kind of want to go back to something we talked about in the very, very beginning, with the costs in the healthcare space right now. You made a little prediction that perhaps in 5, 10 years, we're going to be seeing some alleviation of the bloat of the how astronomical the fees for everything is. Can you tell me what you think the path towards that is, politically in this country, that sort of thing?
Mhm. Well, I think every healthcare organization needs a pricing strategy,
Yeah,
and then they need a contracting strategy, because those two things go together. So because there's no single method of reimbursement for physicians or hospitals, I think that puts healthcare providers in an awkward situation where if everyone were paying us based on value or quality, then we could set up our charge description masters and our charging principles based off of um, outcomes, and versus the more widgets you consume, the higher you get paid. So if we perform 4 services on a patient and we're getting paid fee for service, the more we do, the more we get paid. We really need to move away from that, where the goal is to keep people well, and providers, especially primary care providers, those behavioral health providers, addiction medicine, people that are at the core of keeping us well, both psychologically, physically. If we could get rewarded for good care coordination, good outcomes, keeping people out of the emergency room, keeping people out of hospital beds, we do need to move to value based care. I just think that, the government has been talking about value based care for almost 10 years now, and I've seen very little value based payment arrangements just sprinkled in among traditional fee for service. The more you do, the more you get paid. I think, we just need to take the leap um, to value based care. And I really believe that the only way we're going to do that is through regulation.
yeah,
Unfortunately, it's going to need to be forced, and then everybody will have to get in line and comply. But I think it just has to do with having a plan. Is your cost market sensitive? Are they aligned with the market? Are you in the 95th percentile or are you in the 40th percentile? Understand where you are and where you need to get to, and then have a plan. It might be a multi-year plan because it's not going to happen overnight.
absolutely. No, I completely agree with that. I learned when talking on this podcast with a data analysis that when we're handling money, when we're doing our finances, banks automatically know how much you have, and it's because they've been forced into certain areas of regulation. They communicate, and they have to be accurate. There is not that right now in healthcare. That's what I keep hearing over and over again, and it definitely seems like a need in the next decade. Let's say it that way.
I couldn't agree more. I think we're going to see more regulation, um, just because the complexity of healthcare in and of itself, and then add on top of that the financing of healthcare, which even complicates it further. I don't know how we'll get there unless there's a blueprint given to us and instructions on we're going to go from point A to point C, and we're going to do it over 24 months or 48 months. We really need a blueprint.
Yeah. No, absolutely. And let's veer off more towards the career growth development angle of your area of expertise. What advice would you give to professionals entering the healthcare revenue management field today, especially in terms of skill development and just general career growth?
hmm I think early careerist people that are just starting out, on their path in their career, one of the best things that you can do is network. So I think that networking can be achieved, either through your employer, just getting to know, what are the main departments in your organization and what do they do, going and introducing yourself to those people, seeing is there anything that you can do to help those work units. So if you're interfacing with compliance or legal services or HIM, getting your name out there, getting yourself known. So you could do that at work. But the other great way that you can do it is through professional organizations. The Healthcare Finance Management Association, HFMA, MGMA, the Medical Group Management Association. There are so many like affiliate groups and professional organizations where you can network with peers and more experienced people that have been in the same field 10, 20, 30 years, through these professional organizations, whether they're online, even LinkedIn, right? You can network through LinkedIn. You can join groups. You can follow organizations. So you can do your networking virtually, or you could do it, through meeting participation, through just walking around and talking with people. But networking, I think, when you're entering your career, I don't think most of us know the value of creating relationships, creating professional relationships where you have someone you could call if, a problem presents and you want to vet it, through someone outside of your work. Maybe you're not comfortable talking to your boss about it, but you want a professional opinion. Those are people that you can pick up the phone and call or shoot them
Absolutely.
a text. So I think networking, getting to know the larger end-to-end process that you're part of, that is another great thing, just to socialize yourself more on the big picture versus the one component that you might be involved in as a young careerist.
Yeah, absolutely. And this is the question I like to end the podcast on. If you were able to put a message in a bottle and send it all the way back in time to yourself at the beginning of your career, and yes, you'll put in some winning lotto numbers, and yes, you'll tell yourself to invest in Bitcoin. But other than that, what might you tell yourself at the very beginning?
I guess don't underestimate yourself.
I love that answer. Keep going.
I think we're so critical of ourselves. Many people are more critical of themselves than anyone else would ever be of them.
Absolutely.
And we doubt ourselves. But I think you need to have a vision, create goals for yourself, and work towards them. There's just an endless amount of possibilities out there. So don't box yourself in. Think big. And you can achieve great things.
Absolutely. I completely agree. It's my favorite question of the whole podcast. And thank you so much for coming on. Your insight and expertise has been utterly invaluable. Thank you for the education you've given me. Your perspective isn't one that I don't get a lot of revenue management people on, let me say it that way. And so really, you making time for us I'm so grateful.
Yeah, it's been an honor to be here, Christy. Thank you.
Yes. And that has been our episode this week of When IT Hits the Fan. I have been Christy. She has been Christy. And we'll be back next week. Thank you, everybody.
Take care.